Well, hello. I bring you warm greetings from South Georgia, Valdosta to be a little bit more specific. And again, welcome. My name is Dr. Debra Tann, and it is my distinct honor and pleasure to be with you on today. We have a very good topic on today. It is entitled, What is Dementia? And I am so glad that I have this platform to be able to share briefly with you what is dementia. There are a lot of misnomers about dementia and what it is. And so today, my only job is to make sure that you're comfortable with knowing what is dementia. So, with that, I think it's important that I share just a little bit about my background. I have already stated I am residing in Valdosta, Georgia. Valdosta, Georgia is very close to the Florida line. And most often people know Valdosta because they're on Interstate 75 heading down to Disney World. But nevertheless, it is my pleasure to be with you coming from Valdosta. And so, about me, I have a business that's called Reminiscent. And the business is a brain healthy organization that provides resources and directions for friends and family who are on the dementia journey. And I do call it a journey. And so Reminiscent serves that purpose. And I also work at the local level, again, with Reminiscent, and at the state level with an organization called GUARD. And GUARD stands for Georgia's Alzheimer's and Related Dementias. And I do some collaborative work at the state level, which gives me great honor to represent this lovely state of Georgia. And at the national level, I work with an organization, and you probably heard of this one, AIM, which stands for Alzheimer's Impact Movement via the Alzheimer's Association. And they have appointed me as a team member congressionally to be on the team to speak with, to keep Senator John Ossoff in the loop about all the legislation that is coming down the pipe, if you will, as it relates to Alzheimer's and related dementias. So, as you can clearly see, I do come with a wealth of experience and background. And also, the Alzheimer's authors have chartered me to be the person to tote around, if you will, that's that South Georgia jargon, to tote around the state of Georgia our library of books. So I am Georgia's library carrier. So when I do presentations, which I do a host of them, I take my library with me that has all these wonderful books by superior authors as it relates to dementia. And also, I have to admit, I am just so humbled by this recent opportunity. I was honored in Washington, D.C. at Bright Focus's gala, and I was an honoree of the Community Impact Award. Now, that was a really humbling experience, and I just so appreciate the Bright Focus organization and family for honoring me in June of this year, 2023, with that magnificent award. So I have to say kudos and thank you to Bright Focus. So that was big for me in my space of working in dementia. I also teach at Georgia State University. I teach in the gerontology department, which is the study of aging. So I fit right in quite well in terms of getting the word out about dementia. I want to dive into our conversation. So, what is dementia? If you don't recall anything else that I say to you on this platform, please remember that dementia is not a disease. Not at all. Dementia is not a disease, you guys. It is the symptoms thereof. So you must be thinking, well, what is she talking about? Well, I just told you that dementia are symptoms. So symptoms like what? Hallucination, delusion, colorful language sometimes, a little profanity, if you will, memory loss, repetitiveness, confusion, lack of sleep, or disruptive sleep. Uh, these are symptoms, and they are called dementia symptoms. And believe it or not, there are over 100 dementias because dementia, again, are just the symptoms. So you must be asking yourself at this point, the symptoms of what? Well, let's talk about that and unpack it just a little bit. The top 5 diseases that go along with the symptoms, the dementia I just explained to you, is Alzheimer's dementia disease, vascular dementia disease, Parkinson's dementia disease, Lewy body dementia disease, and last but certainly not least, frontal temporal dementia. So those symptoms, you guys, go along with one of those diseases. And you probably thought to yourself, geez, I've only heard of Alzheimer's. And there's a good reason for that. You probably hear the most about Alzheimer's simply because Alzheimer's has the most prevalence in terms of cases of dementia diseases. And it lies between 60 and 80% when one is given a diagnosis, typically is Alzheimer's dementia disease. So again, I must reiterate that dementia are the symptoms that go along with the disease, and the disease would be the Alzheimer's, the vascular, the Lewy body, the frontal temporal, or Parkinson's disease dementia. I know you got that. I know I'm speaking to a very bright audience right now. So please do keep that in mind. So let's continue our conversation because we've identified the 5 top dementia diseases. And please note, this is very important. There's no cure. Sad to say, there is absolutely no cure for either of the 5 I just mentioned to you. So bear that in mind as we continue on this dementia journey about what is dementia. Yeah. So when we think about the diseases, I want to say that I think early diagnosis is very important. And I'm going to share with you why I believe that. And of course, the scientist isn't a researchers, and the literature points to this as well. When it comes to early diagnoses, you guys, and early diagnoses can give one who is living with one of the dementia diseases the quality of life that they certainly deserve. And they have an opportunity, those living with dementia, they have an opportunity to look at their financials. They have an opportunity to impact a lot of the decisions, pardon me, as it relates to the disease. It gives them an opportunity to better manage the disease. It also has an opportunity for them to, of course, be able to modify comorbidities that go along with the disease. And it gives the family, too, an opportunity to talk about advance directives. How do you want to live your best life at this particular point? So early diagnoses actually points to a lot of great things, particularly as it relates to clinical trials. But early diagnoses is important, you guys. It offers so many thumbs up kinds of things by way of communicating. Because I say, and I will continue to say, because you have a diagnosis of dementia, particularly if it's early on, you can live life well with it. It just has to be managed by you and your care team. And that's one of the things that I always encourage. If you get a diagnosis, put together a care team. A care team for the person living with dementia really helps out exponentially. So, yeah, when we think about early diagnoses, and that's when most of us, including myself, we want to help those at that particular point. But unfortunately, a lot of times I meet people in a crises modality, if you will. But then that deals with education and training and coaching, and that's for another show. But early diagnosis is important. So let me segue just a little bit to clinical trials. Clinical trials, you guys, are research studies conducted with human volunteers, such as yourself and myself, to determine whether or not treatment is safe and certainly effective. Without clinical research, it is very difficult to help anyone because through the research, there comes education, there comes an opportunity to take preventative measures. And it also has an opportunity through clinical research is to produce a cure because as I've already stated, there is no cure. So, yes, clinical trials are very important to me. And while I will always believe that it's going to be through a clinical trial that we have cures for Alzheimer's, Lewy body, vascular, Parkinson's, and frontal temporal, because they're all separate diseases now. They have some overlap, but they're pretty different. And so clinical trials can help delineate which medication should go with the particular disease. And right now, we're suffering from a lack of diversity as it relates to clinical trials. And there's a host of reasons for that. But one of the main things that we do know is that Black and Brown people typically distrust the healthcare system, and rightly so. When you think about historically and even up into current times, there's some validity to that. The research certainly bears that out. But I must say, we need everyone at the table: Asians, Blacks, Hispanics. We need everybody at the table. Whites, we all need to be there, because when one medication works for one group of people, it may not necessarily work for another group of people, which is why clinical research is so important. I use this very simple analogy. Typically, when I'm in a room and I'm presenting, it's quite a few people. So I ask people when I get to this segment, I say, What do you take when you have a headache?" Just by show of hands, just tell me. And then I get all kind of answers: aspirin, Advil, Tylenol extra strength. Get all kind of wonderful answers. And I liken that to, and I draw the analogy, if you will, to same thing when it comes to different races. What works for one race may not necessarily work for another race. And so, therefore, clinical research is important. And you guys, again, when we talk about dementia diseases, there is no cure. And so we need more people to participate in clinical trials and diversify the table just a little bit, if you will. So I think you got me there. I think you're feeling me quite well there. Let's segue just slightly. And I want to talk about it from a global perspective right now. Ideagen is notorious, and rightly so, and should be, to reach people globally. And I think it's important as well, which is why I'm pleased to have this opportunity. Globally speaking, you guys, 55 million cases we have as it relates to dementia worldwide. Imagine that. Sit in that for like 10, 15 seconds. 55 million people, and over 60% of those live in low to middle income households. 60%. So that's 6 out of 10 as it relates to countries. 55 million. That's staggering. And each year, there are 10 million more cases added to this number. In fact, when we think about it, globally speaking, this thing called dementia, it is the seventh leading cause across the globe. The seventh leading cause is this thing called dementia. Seventh. That's high on the totem pole, if you will. So we have a lot of work to do in this space for sure. A lot of work needs to be done in terms of clinical research, in terms of participants, in terms of disrupting this thing called dementia. In 2019, according to WHO, which is the World Health Organization, I've always liked that name. In 2019, globally speaking, once again, there was 1.3 trillion US dollars spent on this thing called dementia. And yes, half of the cost is attributed to families and friends, if you will, who are caregivers. And they typically, on average, do contribute about 5 to 7 hours of caregiving daily, and that's unpaid. So, globally speaking, I must reiterate, $1.3 trillion. So, as you can see, It may sound a little bleak, but in all actuality, you guys, we are making strides, but we need you. We need people like you that are listening to certainly participate in clinical research because I believe that this whole thing called dementia, we can soon and one day, hopefully, put it to rest. So, because I don't want you to think that everything is doom and gloom as it relates to dementia, and remember, those are just the symptoms, and there are over 100 types of symptoms. So, if you begin to see symptoms, you might want to check with your doctor. But I want to share with this as I begin to wrap up. There are 5 pillars of brain health, and I'm big on this, you guys. Now, am I guaranteeing that you won't get dementia if I share these things with you and I encourage you to partake? No, I'm not saying that at all. But I am saying that these 5 pillars will perhaps stave it if, in fact, you will get a diagnosis of dementia. All I'm saying in the long run is that it's going to help. So let's talk about those 5 pillars. Sleep is very important, you guys. Believe it or not, your brain is designed in such a way that every night it does like a vacuum of cleaning to get you ready for the next day. So your sleep and your rest, which are totally different things, I'm talking sleep, is very important. Also, your diet, what you eat. If you can get close to that Mediterranean diet, that would help you and I immensely. Now, let's talk about this for a quick second. Perhaps you're like me and you can't you it's hard for you to follow the Mediterranean diet at its absolute practice. Do the best you can with it. Just do the best you can with it. Modify it. It's okay. Just try to get close to what they're asking us to eat and how they're asking us to eat. Okay? So, our diet and what we take is very important to our brain health. Also, what's essential to our brain health is we need to challenge our brain. That very thing that you say, that's too hard. I don't want to do that. I can't do that. That's the very thing that I need to encourage you to do. Doing your crossword puzzles are fine. And you're probably acing those right now. So that is an indication to me that it's time to step it up. Challenge that brain, you guys. Do that thing or two that you thought you couldn't do, but your brain is going to help you accomplish it. So challenge your brain. Social interaction. You're probably doing it. Continue to do it the rest of your natural life. Engage with other people. Social interaction is so important to brain health. It, I liken it to iron sharpening iron. And we need to be around. I think we're created to be around other people. So make sure you socially interact with your book club, taking dance classes, taking classes at the university, at perhaps at your place of worship. Just interact with others because that helps prevent isolation, and isolation could possibly turn into depression, and we don't want that for you. So continue the social interaction. Yes. And my fifth one that I want to share with you is exercise. Yeah, I know. It doesn't have to be rigorous, but I do need you to get moving. I really do. Exercise. And if you need to start out with 15 minutes and build up to 30 minutes to 45 to an hour, that's good. 3 to 4 times a week. But the point is, exercise is going to help your brain. All 5 of these are essential. Put them all together. Work them as best you can into your life and your lifestyle. So, again, quickly sleep, your diet, challenge that brain, social interaction, and exercise. Yay, yay. Those are the top 5 pillars to brain health. And as I close, I want to thank each and every one of you for listening. I want to certainly thank Ideagen for inviting me to this platform. And again, for you, the listening audience, because I believe together we can defeat dementia. It has to be defeated. So that is my call to action. So in the meantime, and certainly in between time, stay brain healthy. Thank you for your undivided attention. And again, My name is Dr. Debra Tann.